All right, next up we have the Adductor Squeeze Test. This is to assess for adductor strains, and what you need to do before you know these tests is you need to review your anatomy, because obviously we have three adductor muscles, but we also have muscles such as the gracilis and the pectineus that also assist with adduction of the hip. So what you're going to have your patient do if you're suspecting an adductor strain, obviously that's pain in the medial side of the thigh. Maybe the mechanism of injury supports that hypothesis. If you want to test for that, what you're going to do is have them lay supine. You're going to test them at 0 degrees of hip flexion first, so fully supine. And what I like to do is I like to just take my forearm and place it right between someone's ankles, where my elbow and my hand are kind of butting against the ankles, and I just ask them to squeeze in. So go ahead and try to squeeze in. They squeeze in as tight as they can, and if that reproduces their pain, that would be a positive test. You're also going to test this at 45 degrees of hip flexion. And here you can do that arm bracing technique I just showed you, or you can take your two palms, which I prefer to do. And what I say is, don't let me separate your knees. So don't let me separate your knees. I'm going to try to push you apart, fight against me. And then I try to push here. Good. And again, if that reproduces pain, that's positive. And then we bring them all the way up to 90-90, and we do the same thing. Don't let me separate your knees. We try to push apart. And again, reproduction of pain is a positive test. Now, at 0 degrees, we're testing the adductor magnus and the gracilis muscle. And at 45 degrees, we're testing the adductor longus. And at 90 degrees, we're testing the pectineus. And that might help you delineate between which anatomy that you're trying to rehab.